Lesson 23. Exercise guidelines for the older adult. Exercise guidelines and programming for the older adult. At the end of this lesson, you'll be able to describe exercise guidelines for the older adult and design an appropriate exercise program for the older adult to improve overall health and well-being. Programming for the older adult. When designing exercise programs for the older adult, it is important to be aware that there is a huge divergence in abilities and fitness levels within this age group. So many older adults have been active all their lives, and they may participate in marathons or triathlons and other such sporting events. However, the vast majority of older adults have not participated in a structured exercise program for 10, 20, maybe 30 years. Therefore, it's best to begin exercise programs at a low intensity and to gradually progress. Many older adults may have an elevated resting heart rate, or they may be on medication which affects normal heart rate response during exercise. Clients should become familiar with the RPE scale. We can also use the talk test and external observation to monitor intensity. Consider their interest levels, any medical limitations that they may have, and base progression on the client's functional capacity, what they're capable of doing, their health status, their age, preference, and needs or goals. Remember that exercise for the older adult should focus on functional fitness, the ability to carry out normal everyday tasks, to improve quality of life, and to maintain independence for as long as possible. Work on diaphragmatic breathing. This will help them to expand the rib cage and make sure your clients avoid shallow breathing. As balance may not be as good as it used to be, work on enabling the client to get up and down off the floor safely. Develop static and dynamic balance. A minimum of 10 minutes should be given to flexibility training, where stretches are held for 10 to 15 seconds. Ensure your clients stay hydrated. Remember that the elderly have an intolerance to heat stress and have a poor sweating mechanism, so their thermoregulatory capacity or their ability to control their own body temperature is reduced as they get older. Therefore, advise them to wear layers which can be removed or replaced easily. The American College of Sports Medicine recommends the following guidelines for cardiovascular training for the older adult. Frequency, 3 times per week on alternate days. The older adult should avoid working on consecutive days in order to give the body time to recover between sessions. Intensity should be at 50 to 60% of maximum heart rate initially, but it can be increased gradually to 75% of maximum heart rate. Time may need to start at 5 to 15 minute intervals, which can be done 2 to 3 times per day, until the client can sustain exercise for 30 minutes. The type of exercise then should be individualized to each client. Work within their orthopedic tolerance level. Walking is an excellent choice for many older adults. Aquatic exercise is very good for those with orthopedic problems. Also, try to use group exercise as much as possible in order to encourage adherence through social support. When you choose aerobic machines, avoid those with excessively complicated panels and programs. A non-weight bearing type of exercise, such as recumbent bike, also provides support for the back. And cycling in this recumbent position can also enhance blood return to the heart and reduce cardiovascular stress. Frequency, intensity and duration should be changed individually, as altering them at the same time may provide too much overload. Resistance training in the older adult. Muscular strength in most people is maintained to about 45 years of age, but then it falls by about 5 to 10% per decade after that. The average person loses about 30% of his or her muscle strength and 40% of muscle size between the ages of 20 and 70 years. However, it is never too late to improve muscular strength and size through weight training, and elderly people who do so can greatly improve their function and life quality. With the older client, special consideration needs to be given to joint function, individual range of movement, and joint limitations. Older adults generally have limitations in the shoulders, the knees, the hip joints, and initially the health and fitness instructor needs to focus on developing base strength in the major muscle groups, increasing the stability of the joint structures and improving range of movement around the joint. The major muscles, that includes the legs, the chest, the upper back, the shoulders, the arms, the lower back, the abdominals, the cervical region, all of these areas should be targeted in a resistance program. The recommendations for LME and strength training by the American College of Sports Medicine. Frequency, again 3 times per week on alternate days to allow for recovery. Intensity. Intensity varies here from how we would normally describe intensity. Normally, when we are prescribing intensity, we do so as a percentage of 1 rep max. However, for the older adult, we want them to work in a range that is somewhere between LME and strength training. The reason for this is the older adult is losing muscle mass. LME will not cause muscle mass to increase. LME will simply tone the muscle. So in order to try to maintain muscle as much as possible, we need to include an element of strength training as well. So by working at an intensity of between 8 and 12 reps, we are getting a cross-training effect between LME and strength, which is more beneficial for the older adult. So intensity then is 8 to 12 reps, and once the client can lift a weight 12 times, then we can increase the weight by up to 10% and then bring the client back down to 8 reps again. Time. This differs from how we would normally prescribe time for normal population also. Normally we would recommend that time is however long it takes to complete the recommended number of reps and sets. However, for the older adult, we need to ensure that we do not aggravate joints or possibly cause an arthritic flare-up. So time then should be confined to 20 to 30 minutes per session. The type of activity, again, it is recommended that we start with machine weights and then progress to free weights as balance and joint stability improves. Start also with multi-joint, linear. What we mean by that is pushing and pulling type movements like leg press or chest press. And target all body parts, so the quads, pectoralis major, erector spinae, deltoids, biceps and triceps, the abdominals, and the upper and mid traps. If a client has a knee or hip concerns, or perhaps they may have had a hip or a knee replacement, it's very important that they focus on multi-joint linear movements, such as leg press, rather than single joint movements like leg extension, as these would put too much force or too much stress on the joint. Again, ensure that proper technique is followed. Avoid rotational movements like leg abduction and adduction. Focus on proper lifting technique. Range of movement should be through a pain-free arc, proper breathing, and a controlled speed of movement. If there is an acute arthritic flare-up, exercise should be discontinued, and then reduce the load by about 50% or more when returning after a layoff. Balance work. Because balance is so frequently impaired, it's vitally important to include balance as a means of the prevention of falls. Examples of balance work could include one-legged standing near a bar, a wall or a chair, standing up and sitting down without using the hands, walking heel to toe along a line, or the use of step aerobics, where the music speed has been reduced to about 118 to 122 beats per minute. And Tai Chi has also been shown to improve balance in older adults. Click on the button now for a quiz to help you review exercise and the older adult.